Okay, we are live, couple minutes late, but better late than never. And we are here with Eliseo Tajanlangit. I think I said that right this time.
Yes,
All right, good. I've been practicing.
great.
And Eliseo is a RN in PA,
Pennsylvania,
Pennsylvania. Where? Remind me where.
just about an hour north of Philadelphia.
Okay, good. And so you have been in this business for a long time and taking care of patients and getting them discharged and coordinating care outside the hospital. Is that right?
Correct. I've been
Okay.
a nurse for 28 years. And after 20 years, I went to case management. So about 8 years ago. Um, and I am focusing on, usually I'm located in the emergency department. I also have my own floor, so I can go toggle back and forth.
Okay, cool. So, we've talked to you before. You're a great friend of our group here and good friend of mine that we've been friends for a few years through another industry. You're actually an insurance agent like I am too. And so we kind of cross pollinate a little bit with the different industries, but they're all kind of with the same goal of taking care of seniors and helping seniors get the care and the finance help that they need.
Right.
So tell me kind of what's look before we do that, I want to encourage people go to I'll post another link to the video, but go to the YouTube channel by the same name of the group, Home Health Agency Growth on YouTube, and you'll see our interview that we did early last year in 2021, where we covered a lot of really good information in about an hour, talking to Eliseo about what um, case managers, discharge managers, social workers in hospitals, what they're looking for in a referral partner from a home health or home care agency. And there's really good information. We had a really great conversation. There were good comments in the chat that we got answered those questions. So go back and watch that video. But what we want to do today is just kind of catch up and see, what's going on in the hospital and have things changed and what's the landscape, just since you and I scheduled this, before Christmas,
Yeah.
I think things have changed. I know here in Texas, um, we've got a big outbreak of COVID going on right now. There's a testing site right around the corner from my office, and there was a mile-long line of cars to get COVID tests, and that's not the only testing site in town. That's one of them.
Correct.
A mile-long line of cars to get COVID tests. So we've got a problem here. This thing's not going away. It's still scaring people. It's still hurting people. So tell me, how are things in the hospital? Where you're at? How are things going?
It's pretty chaotic, meaning that there's just not enough people to take care of the influx of the people that are coming in. They're sick and scared and just wanting to get tested. In my particular area, one of the for myself as a nurse, and same with my wife who's an ER nurse, and my daughter who's a labor and delivery nurse, and then my um, 20 soon to be 23-year-old is also going is in med surge. Um, we have been working nonstop, and I've been working for the past 8 months almost like every day to be able to staff the hospital. My wife was recently injured because she had just worked too much and still being asked to come in every day. Same with my daughter who's in labor and delivery, who is getting COVID parents who are delivering, and the ramifications from that. And then my youngest daughter, who, just imagine 27 patients, there's 3 nurses to take care of them. They all have COVID, they all have dementia, and they're all trying to jump out of the bed all at once and without any text and without any help in her hospital. So that's kind of like the view that we have that I can share with you. What's how chaotic it can be. My role as a case manager is to make sure that the resources are there for the patients when they're discharged, and the length of stays are increasing because they're really, really sick. And we had to try to figure out what's the next step for them. So, as a case manager, if I don't have the community resources already dialed in and vetted out, um, the patients remain in the hospital. And then the whole hospital kind of slows down. We've had multiple admissions um, in the emergency room, stay in the emergency room, and then I have to come in and disposition that as well and help out with that disposition. But it's just way too much for me to handle, if you can imagine. On the weekends, so that's Monday through Friday, let's say 7 to 3:30, and then on the weekends, we had a pilot program where I cover 3 emergency departments and to try to stave off some of the admissions and also just coordinate resources. And so I was able to be able to see the volume of the other hospitals in the health system. And, what we're trying to do is just make sure that the patients are taken care of and prevent readmissions, because whether they were scared or they just didn't understand the discharge process or what the next steps were, I had to kind of help them out and discuss that with the family so that they can be discharged home where we really want them to be.
Right.
And that's where, my home care buddies are. I was able to, coordinate that with them
Yeah.
in the long run.
So have you seen a change? Obviously, COVID is still very new. It's only 2 years old that we've been dealing with this. And I've seen definitely a change from the beginning of how it was treated. How have you seen a change, just say in the last, I don't know, 6 months, or when you see the last noticeable change in how people are being treated and discharged different from they were, say, a year ago? Are they being discharged sooner? Are they being sent to rehab hospitals?
So the main thing that we're doing is that if you're asymptomatic and you just want to be tested in the emergency room, we just tell you to go home.
Yep.
We encourage you to go to the testing centers where you're more appropriate. Now, if you're symptomatic, then we do more testing. And if you're really needing supplemental oxygen or high flow oxygen, then you really need to be hospitalized. But at sometimes, even the other sick patients hold on to the beds. So we're treating them in the emergency department as well. There's some people who have had, their boosters that also got sick, even though they were vaccinated. So we have to work through that. There's all these different variations, but for the most part, um, we're they're sicker, they're younger, including some of my daughter's coworkers and friends at the hospital. They're young nurses that get really sick, and they have to deal with that. So it's those are the situations that we get to see firsthand that most of the public doesn't see. So we're able to kind of disseminate or kind of aggregate some of the misinformation in the media, as well as actually see it. We've had some tragedies personally. We've had friends that died within 3 weeks of catching it because they were unvaccinated. There's some that had just really had to deal with some deep questions whether or not they were wanting to get vaccinated or not. And so we had to kind of walk them through the process of really making that decision. So it's just a lot of things happening. um, that we
Yeah.
kind of help out in general.
So, and how is your workforce situation? You know, we're dealing with major issues in the home care space. In the hospital, I imagine you're having similar issues.
Yeah, I could technically say that I've been working almost straight for 8 months to a year,
Wow.
right? And that's just so that the hospital can continue to flow. And I volunteer as well, and same with my wife. But with my wife, the just the volume in the ER, she got injured, and so she's been out for like 6 weeks trying to recover from that. And sometime, and then so everybody's talking about, oh yeah, they're making money and all this stuff because you're working every day, but sometimes it ends up to be not even worth it to come in just to help out. You're trying to be the martyr and trying to make sure that people are taken care of, but at some point you have to kind of take care of yourself. Um, but overall, the volume, there's a lot of incentives for us to work up to quadruple bonuses, getting travel nurses. The trend now is having quitting your regular job and travel because there's those crisis pay. But those crisis pay, let's say for nurses right now, let's say it's $10,000 a week, but you go to the dumps, you are working for that money. So there's those trends for the staffing, and to stave off some of that exodus, the hospitals are paying us quadruple bonus just to keep the experienced nurses like me to remain there so that we can take care of the community.
Yeah. Well, thank you for what you do. That's a, the money aside, it's a big sacrifice, for you to work that much and at the risk of your own health. And we really appreciate everything you do.
Oh, thanks.
So let's talk about real quick, what are you looking for nowadays? Like right now,
Mhm.
January 2022, what are you looking for in a home care agency that you prefer for them to be in order for you to feel comfortable referring patients to them?
So let me just give you a context because we're in this group, but some people have just started. Some people are just doing their due diligence. Some people are in mid form, and um, like you started an agency, and then now you're kind of scaling it up. Um, Medicare doesn't pay for home care. Everything's going to be, and they're scaling back on how much they're paying for that. They are also scaling back on their preferences for the patient to go to the skilled nursing facility, and they are incentivizing chronic care management as well as the hospital at home type of model. So you're going to see more persuasive language to go home and then customize your care, and that's what I'm seeing. So like for example, I was taking a chronic care management, um, coding the CPT code, and also chronic care for the primary care physician doctors. In 2022, they raised up that reimbursement for chronic care management for the PCP as well as remote patient monitoring. So you're going to see that trend evolve during the next 5 years, I believe. And what I'm seeing in order to make sure that the patients are discharged to competent care, I want to make sure that the uh, home care companies are established as well as competent, as well as persistent, and as well as they follow up and take care of the patients that I refer them to. There's a dime a dozen in my area. I think on the video I said there was over 400 in my area, and there's plenty enough people to take care of. But certainly, people will learn your reputation and destroy you in seconds if they know that they don't take care of patients. And I've seen that every single day.
Yeah.
Companies' reputation is in the mud because even assisted living or even short-term rehab facilities, they are not getting the reputation. They're not getting the staff, and that's the reason why um, Medicare is moving towards that. Is the hospital at home
Yeah.
and
So
reimbursing that property?
So I think what I'm hearing you say is more and more, which is what I suspected, more and more hospitals are being forced either through just sheer numbers and needing space, but also by Medicare and probably insurance companies too, to send people home still needing that skilled care.
Absolutely, yeah.
Yeah. Yeah.
and
So,
and they're sicker, and that's in.
yeah. So I can tell you one mistake that I think I made when I was starting this business was not getting a skilled license. It wouldn't have taken that much more effort for me to go from getting a non-skilled personal care assistant license to getting a skilled care home health care license. License is not that much different. The difference is in how you staff your company. You have to have an RN on staff to supervise everything, and that's really it, and a little bit more expense on the front end, especially if you're hiring a consultant. But there's so much more that you can do that I could do having that increased level of care. I've turned patients away because they have something that I'm not licensed or qualified to take care of. But it's simple things. It's like a feeding tube or a colostomy, things like that that my non-skilled caregivers just can't handle. But
So
but I
may I interject in that?
yeah.
So you have to, first of all, it's tough to find a competent home health care nurse that's all they want to do. They're seeing the greener traveling traveling nurse positions that are available there, that they could just clock in, clock out for 13 weeks and then go. Same thing with home health care. Yes, I agree. You need a nurse on staff, and that's part of what I would encourage you to do. But below that, I think you can leverage that one nurse to be able to do the immediate evaluation of the patient and what they're going to need. But what I would hire are certified nurse assistants who are able to do like the bandage, the G tube, the flushes, and those types of skilled. You still need a license, but they're more cost effective.
Yeah,
But
absolutely. I agree.
the nursing is the one that's really going to create that plan and then just work around that.
Yep. No, I agree. And are you seeing home care agencies coming to you saying that they specialize in taking care of COVID patients or respiratory patients? Is that
Yes,
the trend that you're seeing?
the main one that I really for the skilled part is the dialysis patients. Uh, whether peritoneal dialysis or just assist them or coordinate, because their Medicare is starting to reimburse you to do dialysis at home. Find those people and kind of train them, go all in that, because so far I'm having a tough time trying to get chair times for dialysis patients. And whatever in your area, whether it's Fresenius, DaVita, or anything like that, they're overworked too, and they have so much. Um, they don't have enough chair times to accommodate all the people who are having renal issues. So uh, also, if I don't know what the logistics are, but just transportation times, 3 times a week, Mondays, Wednesdays, or Fridays, or Tuesdays, Thursdays, and Saturdays,
Mm-hmm.
or just going to the appointments. Um, that's also a problem for us just to deal with that. So there's some that are specialized. Let's say they have the tracheostomy or the peg tube flushes. We're sending them out with nephrostomy tubes that you have to flush. So that's intermittent care, really episodic care. Let's say you can just do 3 visits. So uh, then you can transition to the CNAs or non-medical home care
Right.
piece
Okay.
if you do that.
So I think it goes without saying, if it was hard to get a hold of a case manager to start a referral relationship 2 years ago, it's nearly impossible now. So give us some tips on, if you're just starting to develop a relationship with a hospital or with a particular case manager, what's a good way in the environment that we're in? What's the good way or the best way that you feel to do that?
Um, I'm going to give you somebody who actually listened to me, right? He started out, he was a supply chain guy, and he decided to just go into this business just out of the blue. He was trying to help his family. And so he was a referral within a referral and came to me to the emergency department. And I told him, yes, I'll entertain you. And this is what you need to do is I'll take your card. We'll keep in touch. But you're marketing to the wrong person. You should, I know nothing about you because you didn't have any community presence. But one of the things that you need to do is just be known. Talk to the other people who are out in the community taking care of the patients, right? And that's how you're going to attract my attention, because those community referral partners who are aligned to taking care of the patient and who have who won't step, they're in their own lane. Let's say like a assisted living person who tours the assisted living. Now they're going to put them in the assisted or independent living, and they're noting that they're needing help. So they're going to reach out to you, and that assisted living is trying to get to me as well. And then so I hear your name all over the place, then that's who I'm going to uh, be doing a trial run. The other thing that he did was um, he showed up. He was persistent, off hours, late afternoons, weekends, whatever the acute inpatient rehab situation is needed. He went in and helped out and was a resource. Whether he lost money initially,
Mhm.
they would set it all up and the patient would change their mind, or they just didn't pay. He kept at it and just showed that one case manager that he was on top of his game, and he would really do anything to, first of all, take care of that patient above and beyond. And then next thing you know, there's an email sent out that, hey, if you need somebody, we have vetted this person out. And it was sent out to all 40 case managers, all in the region. So that that's all you need to do is make sure that when I call you and you are able to provide that immediate assistance to help the flow of the emergency department, then you're it.
Yeah.
Now it's just a matter of, if you're starting a solo, you may not get the volume. You may not be there for the volume, but certainly once you're getting comfortable, you can start hiring out, and that's how you scale.
So when you say come in and help out, what do you mean?
So, well, we have the patients that are 91, they're 90s, they live alone, and they need to go to they need to go home, and they have, let's say, no family or infighting family, and they are curmudgeon. They just don't like people. They're racist, or something to that effect. Where the disposition is going to be difficult.
Right.
It may be just a 2-hour gig, right? Uh, or even just 1 hour. You introduce yourself, and you're able to help get that person out, and then get them situated, and then call us back and say, "Hey, this is what I did, and this is what I know," and give us that feedback that you did that. And you did that. If you do that 5 times, yeah, we know how the business goes, and we'll send you more business because you took care of that. Now, later on, when you don't have the capacity, then you start talking about the 4-hour minimums, right? 8
Right.
hour days, or live-ins, or 24/7. But guess where the 24/7 live-in cases start off as?
Right.
Trial runs by the families. They don't know anything about you. One of the things that I've observed in the hospital that the patients, or family members, the power of attorneys, are doing is that they're signing on to, let's say, 3 or 4 different companies, right? And they would test out those caregivers at a moment's notice. They'll do 2 hours, 4 hours, 2 hours in the morning, 2 hours at night.
Hmm.
And when the season comes, when all of the caregivers are being snatched up, they go down their list. So that's on their end, right? Because they know that if they have you know, a job that they can't get away from, or their high-paying job, they just want to leverage you. They want to be able to leverage you so that they can continue with their job, right? And so they need for you to be reliable. And if you're not reliable, then they go down the list. But I know from your end as a business owner, um, yeah, the longer the case, the better. But again, there's some cases that I've referred that they're still doing it 2 years later. So you never know.
Yeah. Yeah, that's true. We always say that when you start out, you've got more time than money,
Great.
right? So you need to do things that you don't want to do, or maybe don't make you a whole lot of money, in order to start to shift that balance to where you have more money than time, and then you can start hiring people and doing other things like paid marketing. So I've got some great business coaches in the home care space that I've learned so much from, and they've taught me and our group about how to develop this network. And really, the goal is to do exactly what you said, is to kind of get your name out there. So if I've got a hospice provider and assisted living home, and maybe a DME provider, those,
Hmm.
those are the really kind of the easier ones to get into. And the hospitals, obviously, the hardest ones to get into. And now you don't have time for phone calls. I'm sure you probably barely even have time for emails. Certainly not going to take the time to answer an unsolicited email from a home care provider. So that's what this, kind of private network of providers is designed to do, is kind of cross pollinate. And if I don't know you and I can't get in front of you anyway, well, maybe somebody else in my network does, and I've done some good business for that person. And so now we can say, hey, do you know anybody over at the hospital in town? Do you know one of the case managers over there? And could I use you as a reference to kind of start edging my way in the door? So I like what you said there in that story that you told. It's perfectly. It's what my coaches teach, and it's a great way to get in the door.
And I'm
Probably
not
not. It's one of the only ways to get in the door. Certainly the
right.
least annoying way to get in the door.
Right. Um, yeah, and just really, the non-medical home care is just a sliver of what is available in the elder care community and taking care of patients at home.
Mhm.
Y- if you just wanted a job and clock in, clock out, then you can work every day like I am.
Mhm.
But if you wanted to be a business owner and you want to take advantage of this, hospital at home or healthcare at home, the opportunity is certainly there. Um, Again, I consult with the other non-medical home care, the adult day. They ask me questions. I kind of, tell them how to, what my opinion are. I'm working with somebody who just paid seven figures for their franchise, and so we're working on the messaging as well as you know the copywriting and just overall strategies to dominate that area. And so it runs the gamut from people who just starting it. Oh, and there's another one that I was working with a certified nurse assistant who just got her first client at a CCRC, the Continuing Care Retirement Community. And whenever she took her client out into the dining room, would say hello to everybody else, and they know who she's connected with, right? And when she leaves, everybody talks. And so she's now up to I think 11 or 22 aides, and that's how it starts, because everybody knows that you're taking good care of that client there, and it's word of mouth. It spreads. She's asked for by name, and the other franchise companies that have contracts with that CCRC have a tough time trying to keep up with her, because she's just she doesn't have the capacity, but she's growing big time. And yeah, I work with her. She works weekends only just for the benefits, and takes care of her um, clients really well.
Yeah, that's great. It's a great story. So, um, I kind of answered all of my questions that I had for you. Tell us, is there anything else? I'm gonna wrap this up after this, and give you a chance to tell us about some other stuff that you've got going on. But what else would you recommend for a home care agency? Somebody starting out, or somebody that's just established and kind of been struggling a little bit. What's some advice that you could give them other than what you just gave us, that they could do that would really make them stand out from the 400 other agencies in town?
The stuff like this, put it on your right. It's what, $75 to get your tag.
Yep.
The other thing is just the non-techie stuff that you would go and put it on. I don't even know if you can see that. Oh, hold on, this way. See how you just show how you are. And this is technological stuff that, and then your CCM, Aging Life Carrier Association, and that's when, hold on, let me see. That's when I saved an inmate. So that's the the low tech, low cost stuff that you can parade when you're driving around. Let's say, just to be known, people will pique their interest and call you, right? And then you can advance to something like this, right? Where these two nurses right here, Jennifer Crowley and Shanna Huber, were able to find me on LinkedIn, which I tell everybody to be in, and they brought the online to offline, and they asked me to be one of 29, or 39 contributors to the book. So now you're kind of published, and that's exactly what you're kind of doing as a marketing. You kind of advance that, right? And that's what I keep telling people. If on my off time on Facebook you're showing up, that you're doing this community thing at the senior center, or just doing little things here and there, doing even just little TikTok stuff, right? Then you'd pop up in my stream on my time off, and then I start, trying to find out where you are. So much, I believe in that marketing piece. It doesn't cost much. That for 2022, um, I'm putting my mouth, where what I'm starting a YouTube channel just to kind of show that this is what you need to do, because videos work 24/7.
Mm-hmm.
Whether if you're an established agency, you show that you've cherish all your workers. You have a monthly, nurse of the month, caregiver of the month, that type of stuff that you can put on your website. Uh, those continue to populate and are there 24/7 and evergreen to then help out your reputation. And then I'll be able to find that out. So just like in general, if I see that and I'm able to Google you with your 5 stars, let's say, and you're connected, and when I check you out on LinkedIn, you're connected to 500 other, you know, my connections, then I go, okay, you're kind of vetted out because you've done your homework and connected with all these other players in the elder care space, right? So,
yeah, and everything that you just mentioned there is free.
right,
YouTube is free.
free.
It doesn't cost anything, and it's YouTube's the number 2 search engine on the internet, right behind Google. And Google, by the way, owns YouTube. So if you get ranked on YouTube, it's very likely that you'll rank for that topic on Google, which is kind of the easiest way to get ranked on Google is to get ranked on YouTube. So that TikTok, I like your TikTok. I follow you on TikTok. I stalk people because I'm not on there myself. I haven't.
Well, listen,
do any TikToks.
Yeah.
But yeah, you do some really good stuff, and all separate from working every day at the hospital. What a really, really hard job. And you're out there helping people with insurance. You're helping other business owners get their businesses going, and that's really great. So I have
one more thing.
Sure, go ahead.
Okay, so 28 years of nursing, COVID is really accelerating what I'm anticipating in the next 5 to 10 years. Again, the video that we did, I think 8 months ago, I said that in the emergency departments, like there's the volume of 150 to 200, sometimes 500 for the big hospitals, right? And just in the emergency department alone, where let's say half of healthcare is being practiced. What I'm seeing is the discussion about burnout. So my 23-year-old daughter, who's going to be nursing, is already seeing that. I'm anticipating that by 2030, when the youngest baby boomer turns 65 and then beyond. Right now, what we're seeing in the emergency department are 70-year-olds taking care of their mid 90-year-old parents who take a great deal of care, that need a great deal of care. From a nurse's perspective, yes, you're taking care of your 2 sets of parents, but we're taking care of 30 parents that within 5 years, if they start dying, my whole entire unit is all going to die. And that's going to really affect the caregiver in us. And there's just going to be PTSD galore. And so what I'm trying to do in starting up this, let's say, YouTube channel, and just it's broadcast the fact that if you're a caregiver, you breathe a sigh of relief when your turn is done, when you're taking care of your parents, and now it's time for you to live. But what if longevity kicks in and your entire life from 70 on is taking care of your elder parents? And that's what you need to plan for. And that's what the opportunity is from the business side, let's say, for caregivers, but you have to. I myself, I'm thinking for my daughters and the other nurses as well, and the other caregivers, that if longevity kicks in and you don't plan for that, that's what's going to happen. Is you're 70 years old, and that's the rest of your life taking, you're 70 to 80, you're taking care of your parents, and you're the times that you really want to travel, you can't, because
Yep.
you have to be the caregiver. Your roles are reversed. And so, anyway, think about that. It's really trying to plan for that, because again, 78 million people dying at the same time in the next 10 years. It's really trying to deal with humanity in itself. So,
Yeah. Yeah. That's why, uh, it's such a huge business opportunity too. So just to put it into business context, um, which is less important than what you just were talking about, but the opportunity is really huge, and we're just on the leading edge of it.
absolutely.
We've got another 20 years of roughly 20 years of baby boomers, and then
Yeah.
so um, and they're all taking care of their parents, just like you said. That's why I got into home care, because my insurance business is nothing but 65-year-old, 65
Right.
year old plus. And so just very easy to add another stream of income and another business and another avenue for taking care of people, which is why we're in the business anyway, was home care. So, yeah, absolutely. 100%.
Yeah, and then and on my end too, let's say, so I'm talking about my daughter, right? But just for those experienced nurses, my goal is to communicate with them on video as well. Is that I think if you're burnt out at the hospital, you can become like me and become a Medicare nurse navigator and have your own little cocoon of community people in the community to take care of.
Mm-hmm.
Um, for the rest of your life, and that'll serve you well. So if you're done with the hospital, you go out to the community, you work with, your businesses, and because you're in your own lane, your nurses that create those care plans, and then you coordinate that with, your CNAs and your other business owners. Um, you'll do well by doing good
Mm-hmm.
and taking care of humanity.
Yep. Yep. I agree. And, you know, um, I have a lot of insurance uh, nurses and pharmacists too, in
Mhm.
my insurance practices as clients, and they're worn out. They take care of so many people for so long, and they either continue taking care of people after they retire, or they but in all this meantime, they've forgotten to take care of themselves. So
Right.
it's really important to set a set something in the future for when you're going to start taking care of yourself, and hopefully that's earlier rather than later.
Yep. And here we are, we're starting it. So.
Yep. So that's great. So do you have a name for the YouTube channel yet? Where can they find it?
So it's in the works, but I think
I'm
the
gonna put you
umbrella
on the
is going
spot
to
and hold
be,
you accountable.
no, hold me accountable, because I've been trying to tell people already. So it's going to be, I think it's going to be under the umbrella of Medicare nurse. No, how to retire from nursing. And it encompasses how to retire from nursing as me, an empty nester. Now, did I just tell you that we became an empty nester about 3 weeks ago? So, what else is there to do as an empty nester? Is just start a YouTube channel. So, how to retire from nursing, and that's my journey of how to retire. My wife and I have been, 28 years of nursing, but it also encompasses my daughter who just had a baby, who um, is going to continue to work in nursing, and then the brand new nurses like my younger daughter, what they need to do right now for the next 5 years to retire from nursing. Of course, they're never going to retire from nursing, but that's just the discussion of that. And under that umbrella is the Medicare Nurse Navigator.
Yeah. Yeah. And I think, it's nursing is one of those occupations where I think you never retire. You're always taking care of somebody. And whether you're doing that in a hospital or in a healthcare setting or in a Medicare Nurse Navigator setting or in a certified geriatric care manager, privately, there's opportunities. You don't have to break your back in a emergency room, till you're 70.
Right.
Yeah. So, all right, great. Anything else you want to add before we wrap it up?
No, we'll continue to catch up. I'm always interested in your journey. I keep telling other people that you're doing what I would be doing if once I start to break out of nursing, that you're dealing with writing the Medicare.
Mm-hmm.
You have your Series 65 and making sure that you're taking care of their wealth. And then on the back end, servicing them with your skilled and non-medical home care company. It's all, all contained in really a smart way to go, but it takes a lot of work. So
yeah, it does. Well, thank you for that. All right. So as soon as you get the YouTube channel, please post it in the group. As you know, I've got a spam-free group, but you are considered vetted and allowed to post in there anytime. So we appreciate you, and let us know if we can do anything for you, and we hope to see you around.
All right. Thanks, Ron. Thanks, everybody.
Right. Have a great day.
Thanks. You too.